everyone. Thank you very much for joining our panel at Digital Davos. Our panel is about misinformation, and I welcome Dr. Salman Al Sabah and Karine Sargsyan, Dr. Karine Sargsyan, and who else we have?
Hi.
Dr. Karine Sargsyan, I was mistagging you just before on one panel. I apologize for this. We had
No worries.
the same name. I apologize for this.
I understand that for the people who are not from Armenia, it's even very difficult to pronounce and very exotic. But in Armenia, Karine is with there at the end is very often. It's a very usual name like Marie, and Sargsyan is every seventh. So, so there will be many more Karine Sargsyans. No worries. I'm used to.
Yeah. Do we have every panelist join?
Tamas should come, actually.
Yeah, check Salam for us is here. Is David already on this? Oh, David, he is later. I apologize. Somebody was just coming in, which is later on. Then? Okay, just add the people as long as soon they come in the waiting room. Thank you very much. So somebody else joined. Okay, so let's start. Ladies first, and you are already on my big screen. So could you introduce yourself to our audience, please?
Hi, I am Karine Sargsyan. I'm working at Medical University in Graz in the education and in biobanking, actually, and I'm also invited professor in several other universities and teaching research management. Why the question of misinformation in research is is exactly targeting my heart. Let's say.
Thank you very much. Dr. Salam, could you introduce yourself to our audience, please?
Yes, hi everyone. This is Salman Al Sabah. I'm a consultant surgeon and also professor at Kuwait University. Also, I have interest in research, and I'm responsible for the research and external collaboration at Kuwait University as well. So it's a pleasure to meet all of you, and it will be a good panel today, and looking forward for a fruitful discussion.
Thank you very much. So we were encountering during this pandemic a lot of issues, from misinformation to social media, and this will cause problems in the future. So I would like to start with you, Dr. Salam. Could you please tell us the biggest misinformations which you saw right now going on, and then we go in how this can be addressed in the future?
So as we know, this pandemic is the most digital pandemic in history. So during the pandemic, we know that communication was a critical factor in supporting health systems, supporting the society, and making sure people getting the right information is really important. And especially there was a need of transparency, there was a need of correct scientific information. And I think this pandemic showed us the importance of the subject. And as we know, with the COVID-19 pandemic, especially, even before that, there was an issue of something called infodemic, misinformation, or and not correct information that comes, especially in the social media aspect. And these days, I mean, we're seeing more and more of that during this COVID-19 pandemic. So I think it's important that from leadership perspective that at international level, people should align science with policymaking, with behavior, and with understanding how we can all coordinate our efforts and collaborate. I think this is an important aspect that's been shown in this pandemic.
Thank you. And I know from our previous discussion that this is, for you, one of the most important issues right now, seeing it also in the future. So, Dr. Sargsyan, could you please tell us what did you see was the most threatening misinformation? And we don't have to go even years back, just within the last 3 months.
Funny question. The worst misinformation for me was that I am COVID ill in the almost lethal status. So, and I was actually healthy and have never got the COVID. So, and my students thought, because this was a rumor. So it's a small thing, but if you somehow reflect that from not the person point of view, but from the general point of view, how many these kind of problems could be in the world, how many people, and this is actually very personal information. And this was discussed all over the university. The point is that misinformation is nothing new to a human being. So the first misinformations and misinterpretation of information the human being had with small pictures in caves on the walls or the stone walls. And this is actually becoming very big because of our information amount that we have due to the digitalization, due to the amount of information that we are getting per day or per hour or per minute. In comparison to only 1 century, we have had 100 times less information. So, and as much as information in general we have, the part of misinformation is in that percentually maybe the same, but in the absolute weight, it's very high. So our goal or our mission as researchers and as science people is to keep it as down as possible and to be easy understandable, to be open, to be to not speak in our own very high level Latin that the people don't understand, but be understandable. Be easy, speak as for kindergarten kids. I'm really giving lectures in to kindergarten kids and to school kids called Kids University Graz, where the people are, the kids are coming and learning how the university is functioning, how the science functioning. And you know, the same language, if you are using in social media, everybody understands. So I think we need to come a little bit down from our high scientific level, which is great and I love it. Please understand me right. But for people who are very high in their positions, but not in the science, maybe something completely different, and we could not understand them, as for instance, a medical doctor could not understand an engineer. Thank heaven my husband is engineer and I understand him good, but in a certain level, the professional language that we are using may be also some obstacle, and we need to do more to catch as much public as possible in a correct information wave.
Thank you. Dr. Hammond, I would like to know your perspective on the misinformation and if it's necessary to reduce the speeches more easily for the public to understand, or is the problem more widespread that scientists spoke too early and not clear enough? Do you agree that the information should be basically, in America, we have a book series called Always for Dummies, and they're really good. Really read this like the whole time you pass your university exams when you read it, because it's clear and simple explained. What do you think that the problem is in a higher level? Communication between scientists, medical professionals, and politicians. What is your opinion?
I think this is an important question. First of all, the problem, if you want to win a fight, you need to define the war and define what your goals are. So the problem here is complex, meaning that the platforms that social media use, for example, some of those, they don't have dislike, they have like and retweet only. So, and they're created not for science. So meaning you have 280 words or letters that, limit you as a scientist to send the right message. So there will be gaps in this message that could be utilized against the scientist and persuade, others. And also so these platforms are not being designed for science, and they're designed for, social communication. So we need to revisit these platforms and make sure that, there will be clear messages to the public where they can understand in a simple language, but also making sure there is no polarization. Many of these platforms could cause polarization. People, follow people with the same mindset, and then, but they don't come across the other opinion. So these platforms, maybe in the future, they should think about how they can, show other opinions, so people could have more better understanding of the problem. Now, I told you it's complex. So even scientists and the community in academia, we have to think about how we can have programs that educate students at the medical universities, also the scientific community, about how to communicate with the public in a simple way that people could understand. And because scientists and people in the healthcare specifically are very busy, so they can put, for example, a message in the media, but they don't have enough time to reply and take their time and discuss in more details. There's for sure the scientists and physicians, they put a lot of effort to deliver messages, and they did a great job during the pandemic. But also not all of them are the same. So meaning that we need to establish education. We need to think about how we work on these social media platform that to deliver the right messages and help to deliver more scientific material. Also, we need to think about this technology, how we can use it to our advantage. For example, how we can use AI, for example, to help us to deliver the right message and information. Nowadays, you can barely, human beings could barely understand two people speaking at the same time. That's our mind capacity. Now, nowadays, people speaking to you and using social media at the same time. So no wonder of misunderstanding and miscommunication that's been happening. So I think we need to rethink about how we can approach delivering the right messages, And so we reduce as much as we can the miscommunication or misinformation. Now, we know that we need to have evidence-based messages, evidence-based policies, and that take into consideration behavior science. And so we have to have psychologists, and we need to have behavior scientists helping us through this journey. I mean, this pandemic was a wake-up call for everyone. It changed many things on all different levels, okay? And if we want to fix this problem, we have to fix it at all levels. It's not about changing leadership. It's not about just working on people on the ground. It should be on all levels. And education is an important part of that. Using technology to our advantage by, reforming the technology in order to make sure that it delivers the right message. And also being transparent and being open for interpretation. It should not be a fixed mindset. It should be a growth mindset, and making sure that we, be open-minded. We are in a fast century, right? So we're making sure that all this information could be, digested very well, and be open-minded and make sure that as much as possible, deliver the right message.
One follow-up question for this. So you touched several points like group thinking, you touched points about the right messages and the communication to the masses. My question is, do you see a problem that scientists, when professional people speak together, we often speak loud, rely only on our data because we just made this experiment and we speak about our data and all the other data were not shared. And for this, we have always the process from peer-to-peer review. But when we address the public without being peer-reviewed with the opinion, for you, for Dr. Sargsyan, everyone is clear. We just say what we found, and we say we should look at this problem. But the public may see it as this is already a problem. Could you elaborate? Do you think this is a problem, or is it more a problem of group thinking of the scientific community, and we are good, we have the solution, and we don't look somewhere else? What is the bigger problem? The first one, to recap, basically that we speak and the public picks it up, or the second one, that we go in a group thinking and we selectively filter the information. Which one do you think is worse? So
the last sentence I said in my previous talk was that we should be open-minded and with a growth mindset, and we're open for interpretation. We cannot just be fixed on certain areas because we know things moving fast. We've seen this with the vaccine, for example. Was incredible the amount of effort to create the vaccine up to the supply chain. That was amazing, never before in history. Yet we should be open-minded because vaccine could work in certain variants, but not all of them. And that, being open-minded, not being fixed to a certain idea, it's very important, especially in crisis. You have to be more dynamic than in the routine work. In crisis, it's a different game than compared to a certain routine time, right? So we have to make sure that you're open-minded. You have not to be either with groups or your fixed mindset. You have to understand the situation you're in. You have to understand your network and understanding what's going on around the world. Now the world is like global, as you know, and countries should work together in a harmonized way. For example, today we see the Prime Minister in the UK mentioning that they will reduce restriction, no need for masks and so on, and other countries they have restriction. So we need to coordinate globally and work together so we deliver the right message, because public see different countries do different things, different health system do different things. That might cause confusion to the public. We as scientists, we understand, we know what the R naught is. We see the infection. We see how the health system is coping with this disease, and then we use that dynamics to decide. But nowadays we are global. Now, whatever happens in the world, it will affect you. So, if, for example, equity of vaccine, if the vaccine was not distributed with fairness, then the disease will come to you, right? So making sure that we work globally, we should not be fixed to a group or a mindset. We have to make sure that we are transparent, especially in crisis, and we make sure that we educate ourselves before even educating the public. And nowadays we have to teach, physicians to be scientists, engineers to be scientists, engineers. Same thing with policy. Policymakers should be scientists as well in terms of how they critique and read messages. It's not about so programs, science with every specialty should be there to make sure that we have, when a pandemic comes next, we have the skills, we have the right infrastructure for it to deal with. So this is my input on your question.
Thank you.
May I add?
Same question. So you can add. Should I summarize the question again, or should we pick up?
No, I will pick up. The first thing is that thank you very much that you said about the psychologist and communication specialist and the scientist we should be, and the doctors. So as I graduated the medical school and decided to be a scientist, at a certain point I understood that I should be able to communicate, and then I studied psychology and communication. So I have 2 degrees because I understood that I need that. Absolutely agree with you. And at our university, for instance, in Graz, in Masters in Biobanking, we're specifically educating people how to communicate science. So there are specific courses, and they are very, very busy, these courses. So absolutely agree that we need that. Nevertheless, the education is a rather slow process. At the moment, for much more dynamics and plasticity of the situation, we need the communication specialists nearby us, because, for instance, for big corporations, they have marketing specialists and marketing departments that are doing the communication for them. The same thing are now requiring the doctors and the scientists who are acting in this pandemic towards the World Health. We need also some marketing department that can break down the messages to understandable pieces and clear pieces that could not be misunderstood. Well, if a human being wants that, they can always interpret anything differently, but mostly it could help in one hand. In another hand, the difficulty in our side is because we are grouping in different parts, and even in the scientific community, sometimes we are not in the same boat. And this makes even more confusion if it is openly discussed, because it can be a very small thing, and in the big picture we understood and we are the same in the same boat. But a small thing that we're discussing can cause a huge, let's say, a panic attack in the society because they don't really deeply understand. Nevertheless, there is another bigger issue in communication and miscommunication of science, as I see, that during this pandemic became even more real. This is the not good done science. If you look through the retracted papers, the numbers of retracted papers from even Nature, from Cell, from Frontiers of Oncology, and so on. Between the last 20 years, if you see the graphs, just Google, how it's going up and up and up, the number of retracted papers, because of something scientists have done wrong. And these stories then becoming in the newspapers more like anecdotes. And that's why the people are more prone to not trust if we say something. So first, we need to do the science correct. Second, we need to have really the communication skills to be able to communicate, to speak, to talk. I have been a TED organizer and was looking for scientists that can come to the TED and speak understandable. It was so difficult. Brilliant scientists to find was very easy. To find brilliant scientists who can speak for a broader audience is very difficult. So I absolutely agree with my colleague panelists that we need communication skills. We need to teach our people to talk, and we need psychology also to understand how to do that. Nevertheless, the first thing what we should do is our homework to do the science correct, and then communicate the clear science as easy words, in as easy words as possible. Sorry, I have spoken today 6 languages. I'm struggling, sorry.
Don't worry. So we see the problem from the communication from the scientists. And we know that other opinions, papers are retracted. This is not new. It was just because knowledge was developed in front of our eyes in a really big speed this time. And the knowledge exchange became public, which normally is not newsworthy, but this time it was newsworthy. So what do you think is more the responsibility? Is it, of course, responsibility is always shared, but the responsibility from the scientists to be much more careful, or the responsibility from the press outlets, from the media, to take the time and to ask 3 or 4 scientists and speak with the scientists to communicate instead of make it immediately a headline? What is the bigger problem?
Oh, this is easy question, 50-50.
50-50. Dr. Salman, what do you think about this?
So I think trust is the most important thing in civilization, right? And I think restoring trust is important. So, and that's why it's important to collaborate and coordinate our efforts with all the specialties, and making sure we do our best utilizing, all these social media platforms, technology, and so on to our advantage. I think also, science, it's a dynamic, complex, and to have a clear message, sometimes it's really challenging. And because it depends on trials and experiments and time, so many factors are involved in it. However, I think we have to make sure that we do our best to make sure that the society trusts us, and that needs something called, rebalancing the society. So meaning that there should be a balance between the private sector, the public sector, and the non-profit sector, all working, equally with certain goals and working all together in a way that brings trust to the society. If there should be balance between innovation and profit, and vaccines cost, is innovation cost, there's there's profit in it, but the balance of this equation is important, so people could trust the product at the end. So what I'm trying to say, we have to think about the infrastructure, the skills, and how we can rebalance the society. Not more toward the private sector, not toward the government, not toward only non-profit, how all these elements work together to deliver the right message and do their best to bring trust back to the society. I think this is critical.
Thank you. We have 2 minutes left, 1 minute per person. The question is, we saw also that a lot of people claim scientists not to have a backbone and stand up to the politicians. Scientists were in the situation where the politicians were our shareholders, basically, and we didn't want to contradict the people which give us the money for research which we absolutely needed. But we saw also scientists standing next to politicians saying sometimes absolutely wrong information, and you saw only the politicians, the scientists changing the face, but not daring to publicly criticize the information. Do you think scientists should get more backbone or should just not be put in such a situation? So basically, should scientists stay out of politics totally, or should they have the courage to correct when they hear something wrong in the politics? Each one a minute. Karen, we start with you.
So I think I cannot remember this kind of situation, but maybe because I was looking to the other side of the world. But being honest, independently, if scientist, doctor, or politician, each person who cares about the future of our planet Earth should have a backbone, stand up and say that if something wrong.
Thank you very much.
This is my minute.
The Salman?
Yeah, so the virus, the COVID-19 disturbed not only health hospitals or health system, it disturbed the whole society, meaning that every message we're delivering, every information, it has a policy behind it, or policy that the piece of science will lead to certain policies. So everybody is involved in it at all levels. So that's why it's important that we make sure politicians, they should be trained also in evidence-based policy. Physicians should be trained into evidence-based policy. Engineers. So we need to make sure the society is rebalanced, restructured, making sure they all work together in a collaborative way and coordinated. So it's nothing politicians by themselves just doing their thing, or physicians asking. Nowadays, the COVID-19 showed us it's not about just healthcare, because the virus disturbed the economy, disturbed our lives, disturbed healthcare. So we have all to work together to deliver the right policy, utilizing behavior scientists to help us with our cultures, because we have all different cultures. We utilizing psychologists to help us in doing the right policy, because policies should have looked in a holistic approach. It's not just policy making are doing their job. I think we have to think differently. The pandemic was a wake-up call for that, and I think we all learn from it. And I think we have to make sure we work in a collaborative way to save our society, to have the virus showed that everything is possible. Who could imagine one day that people will be locked down in their houses, right? So people could change, but we have to work together, and nothing is impossible. But making sure we do it in an evidence-based way. And again, thank you for asking this question.
Okay, thank you very much. We are already 2 minutes over time, and I know the next panel is reading. I know it's a really important panel. We could go on for really an hour more. I thank you, everyone, for participating at Digital Davos and for your insight. Have a good evening. And I overgive it now to the next panel. Thank you.